Think for a moment about the last time you woke up feeling genuinely restored. Not just rested, but truly refreshed, with your mind clear and your body ready for the day ahead. For many of us in the later decades of life, those mornings become less frequent, and we tend to accept this as simply the way things are. We attribute it to aging, to the natural accumulation of years, to the inevitable decline that everyone tells us to expect. But what if the explanation for those restless nights and groggy mornings lies somewhere else entirely? What if the position you assume each night, something you do without thinking, has been quietly influencing not only the quality of your rest, but the very function of your heart? And what if a small, almost invisible adjustment could shift the entire trajectory of how you feel each morning when you open your eyes? You are listening to the Longevity Library, where we archive the wisdom of healthy aging. The unfolding gift of sleep. How nightly rest shapes the longevity of heart and mind. There is a moment, just before sleep arrives, when the day's demands begin to recede. The breath deepens. The muscles release their held tension. The mind, for a few blessed minutes, drifts between worlds. This transition, repeated night after night across a lifetime, represents one of the most profound yet overlooked influences on how we age. Consider the numbers for a moment. If you live to 85 years, you will have spent approximately 25 of those years asleep. 25 years of horizontal existence. 25 years during which your heart continues beating. Your lungs continue drawing air. Your brain continues processing and repairing. The question naturally arises: if we spend 1/3 of our lives in this state, what might it mean to inhabit those hours more wisely? For much of human history, this question would have seemed peculiar. Sleep was sleep. One lay down when darkness fell and rose with the sun. The idea that the position of the body during those hours might matter, or that the environment surrounding sleep could influence long-term health, would have struck our ancestors as unnecessarily complicated. But we now understand that sleep is not merely a pause between days. It is an active physiological state during which the body performs essential maintenance. Tissues repair. Memory consolidates. The cardiovascular system recalibrates. And the manner in which we sleep, the posture we maintain for 7 or 8 hours, the conditions we create in our sleeping environment, all of these factors influence how effectively this nightly restoration occurs. This is not a conversation about sleep disorders, though those certainly matter. Nor is it about achieving perfect sleep, whatever that might mean. Rather, it is an exploration of how small, consistent choices around sleep can accumulate over decades into meaningful differences in how we feel, how we function, and how gracefully we navigate the later decades of life. The body's nocturnal geography. To understand why sleep position matters, it helps to visualize the body as a three-dimensional structure with organs that shift and settle according to gravity's pull. During waking hours, we are upright or moving, constantly changing position, rarely remaining in one posture long enough for sustained compression or gravitational effects to become significant. Sleep changes this entirely. When you lie down for 7 or 8 hours, gravity acts upon your internal organs continuously. The heart, suspended within the chest by major blood vessels and surrounded by the protective pericardial sac, shifts slightly depending on whether you lie on your back, your stomach, or either side. The lungs, encased within the rib cage, expand more freely in some positions than others. The great vessels that carry blood to and from the heart follow pathways that can be either supported or compressed by the position you maintain. For a young person with resilient tissues and robust cardiovascular function, these positional effects are typically negligible. The body compensates easily. But as decades accumulate, tissues gradually lose some of their youthful elasticity. Blood vessels may become slightly stiffer. the heart's pumping efficiency may diminish in subtle ways, and the cumulative effect of nightly posture begins to matter more. This is not a dramatic effect. No one will develop heart disease simply because they sleep on their left side. But for those already navigating the normal cardiovascular changes of aging, attention to sleep position becomes one of many small factors that together shape how well the system functions over time. The stomach sleeping position and its effects. Among the various sleep postures, stomach sleeping deserves particular examination because it involves the most extreme departure from the body's neutral alignment. When you lie face down, several things happen simultaneously. The rib cage, designed to expand and contract with each breath, presses against the mattress. This external resistance means the lungs cannot fully inflate. The diaphragm, the primary muscle of breathing, must work harder to draw air against this resistance. Over the course of a night, this translates into slightly reduced oxygen intake. The heart, sensing lower oxygen levels, may increase its work slightly to maintain adequate delivery to tissues. The neck must rotate sharply to one side to maintain an open airway. This sustained rotation places stress on the cervical spine and can compress the vertebral arteries that supply blood to the brainstem and posterior brain. Some individuals wake with headaches or a sense of grogginess they attribute to poor sleep, unaware that compromised blood flow may be contributing. The weight of the body rests directly on the chest and abdomen for individuals with acid reflux or digestive sensitivities. This pressure can force stomach contents against the lower esophageal sphincter, increasing the likelihood of nighttime reflux episodes that disturb sleep and may trigger reflexes affecting heart rate. For those with pre-existing respiratory conditions, such as chronic obstructive pulmonary disease, the restriction imposed by stomach sleeping becomes more significant. Even a small reduction in lung expansion, repeated nightly, can contribute to overall respiratory strain. Many stomach sleepers adopt this position because it feels familiar or because they believe it reduces snoring. While it is true that stomach sleeping may temporarily improve airway patency for some individuals, the trade-offs in terms of respiratory restriction and spinal stress warrant consideration. The left side. Anatomical considerations. Side sleeping represents the most common position among older adults, and for good reason. It generally supports spinal alignment and reduces the likelihood of airway collapse compared to back sleeping. However, the choice between left and right side carries different physiological implications. The heart sits slightly left of the midline within the thoracic cavity. When you lie on your left side, gravity draws the heart toward the chest wall. The heart now rests against the firm surface of the rib cage rather than suspended more centrally. This positional change has several consequences. The heart's electrical activity may shift subtly. Studies using electrocardiography have documented changes in cardiac electrical patterns when individuals lie on their left side. For hearts with normal conduction systems, these changes remain within typical ranges. However, for those with existing cardiac conditions, particularly individuals with congestive heart failure or certain arrhythmias, these electrical shifts could potentially influence symptoms. The great vessels that carry blood to and from the heart follow specific anatomical pathways. The aorta arches upward and backward from the heart's left side. The pulmonary arteries branch to the lungs. When lying on the left, these vessels may experience slightly different gravitational forces than when lying on the right. Some research has suggested that left-side sleeping may increase cardiac workload in individuals with pre-existing heart failure. The mechanism appears related to the heart's position relative to the thoracic wall and the subtle increase in pressure required to pump blood against gravity in this orientation. Patients with advanced heart failure sometimes report that they cannot tolerate lying on their left side because it provokes shortness of breath or palpitations. It bears emphasizing that for healthy individuals without known heart conditions, these effects are typically insignificant. The body's regulatory mechanisms easily compensate for positional changes. The concern arises primarily for those already navigating cardiovascular changes associated with aging or managing diagnosed heart conditions. The right side, a gentler orientation. Among the sleeping positions, right side sleeping emerges as particularly favorable for cardiovascular function, especially in older adults. The anatomical basis for this advantage relates directly to the heart's position and the arrangement of major blood vessels. When you lie on the right side, gravity shifts the heart away from the chest wall, allowing it to rest more centrally within the thoracic cavity. This position minimizes external pressure on the heart muscle and reduces mechanical interference with cardiac function. The inferior vena cava, responsible for returning blood from the lower half of the body to the heart, courses along the right side of the spinal column. Right side sleeping places this vessel in an optimal position for blood return, with gravity assisting rather than impeding flow. Unobstructed venous return means the heart receives adequate blood volume to pump with each beat, maintaining efficient circulation without compensatory increases in heart rate. For individuals with certain heart conditions, the benefits of right-side sleeping have been observed clinically. Patients with congestive heart failure often report better tolerance of right-side positioning, with fewer episodes of nighttime shortness of breath or palpitations. Those with atrial fibrillation may experience more stable heart rhythms during right-side sleep, possibly due to reduced mechanical irritation of the atria. Beyond cardiac considerations, right-side sleeping supports digestive processes. The stomach and pancreas hang more naturally in this position, allowing gastric contents to empty appropriately into the small intestine. For those who eat evening meals, this positioning may reduce the likelihood of reflux that can disturb sleep and trigger cardiovascular reflexes. The supported back position. Sleeping on the back with proper support represents another option worth considering, though it requires attention to specific details. The supine position, when executed correctly, distributes body weight evenly across a large surface area, reducing pressure points and allowing muscles to relax fully. For cardiovascular function, back sleeping with slight elevation of the head and upper body offers distinct advantages. This semi-upright position reduces the work required for the heart to pump blood to the brain against gravity. It also facilitates diaphragmatic movement, allowing fuller lung expansion and better oxygenation throughout the night. However, back sleeping presents challenges for certain individuals. Those with sleep apnea or significant snoring require particular caution. In the supine position, the tongue and soft palate can fall backward, narrowing or obstructing the airway. This can lead to repeated episodes of apnea, during which breathing stops temporarily, blood oxygen levels drop, and the heart must work harder to compensate. Over time, untreated sleep apnea places significant strain on the cardiovascular system. For individuals without significant airway issues, properly supported back sleeping can be excellent for overall rest. The key lies in achieving the right alignment. A small pillow or rolled towel placed under the knees maintains the natural curve of the lower back and prevents the body from sliding down during the night. Head support should be sufficient to maintain neutral neck alignment without forcing the chin toward the chest or allowing the head to tilt backward excessively. For those with orthopnea, a condition in which lying flat causes shortness of breath, elevated back sleeping becomes essential. Using a wedge pillow or adjustable bed base to raise the head and upper body by 30 to 45 degrees allows comfortable rest while maintaining cardiac function. This position uses gravity to slightly reduce venous return to the heart, decreasing workload on a weakened heart and reducing pulmonary congestion. The process of positional change. Changing a sleep position after decades of habit requires patience and a systematic approach. The body has learned to associate certain positions with sleep onset, and disrupting these patterns can initially feel uncomfortable or unnatural. However, with consistent effort, most individuals can successfully adopt new sleeping postures that better support long-term health. The first step involves simple awareness. For several nights, notice which position you assume when falling asleep and which position you find yourself in upon waking. Many people discover they change positions multiple times during the night, often returning to familiar postures without conscious awareness. This information provides a baseline for understanding current patterns. For stomach sleepers wishing to transition, moving first to side sleeping, preferably the right side, represents a logical intermediate step. A body pillow placed lengthwise along the front of the body can provide the sensory input that stomach sleepers associate with comfort and security. Hugging this pillow prevents rolling forward onto the abdomen while maintaining the feeling of something against the chest and stomach. Placing a firm pillow behind the back creates a physical barrier that discourages rolling onto the undesirable side during the night. Some individuals find that sewing a pocket into the back of their sleepwear and inserting a tennis ball provides a gentle reminder when they attempt to assume an old position. For left side sleepers wishing to favor the right side, begin each night consciously positioned on the right, using pillows strategically placed behind the back and between the knees for comfort and stability. The pillow behind the back prevents rolling left during the night, while the knee pillow maintains hip alignment and reduces lower back strain. Alternating sides can also work well for those who find strict right side sleeping too restrictive. Spending part of the night on the right and part on the left distributes any positional effects and may be more sustainable than attempting to maintain a single position all night. For those choosing back sleeping, proper support becomes paramount. A wedge pillow providing gradual elevation from the waist up offers better support than multiple stacked head pillows, which can create neck strain. Knee support remains essential to prevent lower back arching and to maintain the spine's natural curves. The sleep environment as a health factor, beyond position itself. The broader sleep environment significantly influences both sleep quality and physiological function during the night. Attention to these factors can enhance the benefits of proper positioning and support the body's overnight restorative processes. Room temperature deserves careful consideration. The body's core temperature naturally drops during sleep, a process that facilitates rest and allows metabolic processes to slow. A cool room, typically between 65 and 70 degrees Fahrenheit, supports this natural temperature regulation. Excessively warm environments can disrupt sleep architecture, causing frequent awakenings and preventing the deep sleep stages during which the most effective restoration occurs. Light exposure similarly affects sleep quality and physiological function. Darkness triggers melatonin production, which not only facilitates sleep onset, but also has properties that may support various aspects of health. Blackout curtains or a quality sleep mask can eliminate light pollution that might otherwise suppress melatonin secretion. Even small light sources, such as glowing alarm clock displays or streetlight filtering through windows, can disrupt sleep for sensitive individuals. Noise, whether sudden or continuous, activates the sympathetic nervous system and can elevate heart rate and blood pressure during sleep. White noise machines, fans, or gentle nature sounds can mask disruptive noises and create a consistent auditory environment that supports uninterrupted rest. For those living in urban areas or near traffic, this becomes particularly important. Mattress quality directly affects the ability to maintain healthy sleep positions. A mattress that has sagged or developed depressions may encourage rolling into unfavorable positions or create pressure points that prompt frequent position changes during the night. Medium-firm mattresses generally provide the best combination of support and pressure relief for older adults, allowing the spine to maintain neutral alignment while cushioning bony prominences. Pillow selection deserves equal attention. The ideal pillow maintains the head and neck in alignment with the spine, neither forcing the chin toward the chest nor allowing the head to tilt backward. Side sleepers typically require thicker pillows to fill the space between the ear and shoulder, while back sleepers need thinner pillows that support the natural cervical curve without elevating the head excessively. Stomach sleepers, if they continue in this position, require very thin pillows or none at all to minimize neck strain. The hours before bed. What happens in the hours before bedtime significantly influences sleep quality and physiological function during the night. Establishing routines that signal the body to prepare for rest can enhance the benefits of proper sleep positioning and support overall health. Meal timing plays a role worth considering. Digestion requires increased blood flow to the gastrointestinal tract, diverting resources from other systems and potentially interfering with sleep onset. Large meals consumed within 2 to 3 hours of bedtime can also trigger reflux, which may awaken the sleeper and provoke physiological responses. A light evening meal, finished at least 3 hours before retiring, allows digestive processes to complete before sleep begins. Fluid management requires balance. Adequate hydration throughout the day supports overall function, but excessive fluid intake in the evening leads to nighttime urination that disrupts sleep. Each awakening involves rising, walking, and returning to bed, all of which elevate heart rate and blood pressure. Limiting fluids in the 2 hours before bed reduces these interruptions while maintaining daytime hydration. Caffeine's effects on the nervous system persist longer than many realize. The time required for the body to eliminate half of the consumed caffeine ranges from 4 to 6 hours in healthy adults and may be longer in older individuals due to age-related changes in metabolism. Afternoon coffee or tea can thus interfere with sleep onset and reduce sleep quality hours later. Caffeine also acts as a mild diuretic, contributing to nighttime urinary frequency. Alcohol presents particular challenges for sleep. While alcohol initially produces sedative effects that may hasten sleep onset, it subsequently disrupts sleep architecture, reducing the amount of time spent in deep, restorative sleep stages. Alcohol also affects heart rate variability and can trigger irregular rhythms in susceptible individuals. The common belief that alcohol promotes good sleep contradicts the physiological evidence. Evening screen time deserves consideration in any discussion of sleep preparation. Electronic devices emit blue wavelength light that suppresses melatonin production more effectively than other light wavelengths. This suppression delays sleep onset and can shift circadian rhythms over time. Additionally, engaging content, whether news, social media, or entertainment, keeps the mind active when it should be winding down. Creating a screen-free period of at least 1 hour before bed supports the natural transition to sleep. The practice of winding down. The transition from daytime activity to nighttime rest benefits from intentional practices that signal the nervous system to shift from alertness to calm. These practices directly affect heart rate and blood pressure, preparing the body for the reduced demands of sleep. Deep breathing exercises offer one of the most accessible and effective relaxation techniques. Slow, diaphragmatic breathing activates pathways that slow heart rate and promote calm. A simple pattern of inhaling for 4 counts, holding for 4 counts, and exhaling for 4 counts can be practiced in bed just before sleep. The focus on breath also redirects attention from ruminative thoughts that might otherwise maintain mental activity. Gentle stretching before bed can release muscle tension accumulated during the day without the stimulating effects of more vigorous exercise. Simple stretches targeting the neck, shoulders, lower back, and legs can be performed while lying in bed, further reinforcing the association between the bed environment and relaxation. For those who find it difficult to quiet an active mind, practices that engage the imagination can help. Picturing a peaceful scene, recalling a pleasant memory in detail, or mentally walking through a familiar place can shift attention away from worries and toward restful states. The key lies not in which technique one chooses, but in consistency. Practicing the same winding down routine nightly strengthens the association between these activities and sleep, making the transition increasingly automatic over time. Daytime foundations for nighttime rest. Sleep does not exist in isolation. What happens during waking hours profoundly influences how well we sleep at night. Attention to certain daytime patterns can support both sleep quality and overall physiological function. Physical activity during the day improves sleep quality through multiple mechanisms. Exercise increases sleep drive, the body's natural pressure to sleep. It reduces anxiety and depression, which commonly interfere with rest. It helps regulate circadian rhythms, reinforcing the natural cycle of alertness and sleepiness. For older adults, appropriate activity levels depend on individual health status and functional capacity. Brisk walking, swimming, cycling, and share exercises all provide benefits without excessive joint stress. The key lies in consistency rather than intensity. Regular moderate activity confers greater long-term benefits than sporadic vigorous exercise. Timing matters. However, exercise too close to bedtime can increase core body temperature and stimulate the nervous system, potentially interfering with sleep onset. Finishing exercise at least 3 hours before bedtime allows body temperature and heart rate to return to baseline before sleep begins. Exposure to natural light during daytime hours helps maintain robust circadian rhythms. Morning light exposure in particular signals the biological clock, reinforcing alertness during the day and promoting sleepiness at the appropriate evening hour. For those who spend much time indoors, a morning walk or simply sitting near a bright window can provide this beneficial light exposure. Daytime stress management also influences sleep. Chronic stress elevates levels of hormones that keep the body in a state of alertness, making it harder to transition to rest at night. Practices that reduce stress during the day, whether through physical activity, social connection, engaging hobbies, or simply building moments of quiet into each day, can pay dividends when bedtime arrives. Social connection and rest, the quality of our social lives, surprisingly, influences how well we sleep. Humans are fundamentally social beings, and the sense of connection or isolation we experience during waking hours affects our nervous system's ability to settle into rest. Research has consistently shown that individuals with strong social ties tend to sleep better than those who are socially isolated. The mechanisms likely involve both psychological and physiological pathways. Feeling connected to others reduces anxiety and provides a sense of security that allows the nervous system to downregulate at night. Social engagement also provides mental stimulation and emotional fulfillment that contributes to overall well-being. For older adults, maintaining social connections may require more intentional effort as life circumstances change. Retirement, relocation, health challenges, and the loss of loved ones can all reduce social contact. Finding ways to maintain meaningful connection, whether through family, friends, community groups, or shared activities, supports not only emotional health, but also the quality of rest. Evening social interaction, however, should be considered in terms of its timing and nature. Stimulating conversations or emotionally charged interactions close to bedtime can activate the nervous system and delay sleep onset. Calm, pleasant social contact earlier in the evening supports winding down, while intense interactions are best scheduled earlier in the day. Purpose and its role in rest. Beyond social connection, a sense of purpose in life has been associated with better sleep and numerous health outcomes. Having reasons to wake up in the morning, feeling that one's life has meaning and direction, appears to support the body's natural rhythms and resilience. This connection likely operates through multiple channels. Purposeful individuals tend to engage in healthier behaviors overall, including those that support good sleep. They may experience less stress and rumination, allowing easier transition to rest. The sense that one's life matters may buffer against the anxiety and depression that so often disrupt sleep. Purpose need not be grand or publicly significant. It can be found in caring for family, pursuing creative interests, contributing to community, maintaining a garden, or simply appreciating beauty each day. What matters is the sense that life holds meaning beyond mere existence. For older adults navigating the transitions of later life, maintaining or discovering new sources of purpose becomes an important aspect of overall health, including the health of sleep. The heart's nightly work. To appreciate why all of these factors matter, it helps to understand what the heart experiences during sleep. Far from shutting down, the cardiovascular system remains active throughout the night, though its work changes in character. During non-REM sleep, which occupies the majority of the night, heart rate slows and blood pressure drops. This relative quiescence allows the heart muscle to recover from the demands of daytime activity. The reduced workload gives cardiac cells opportunity for repair and maintenance. During REM sleep, heart rate and blood pressure become more variable, fluctuating with the content of dreams. These fluctuations are normal and generally well tolerated by healthy hearts. However, for those with compromised cardiovascular function, this variability can occasionally trigger symptoms. Throughout the night, the autonomic nervous system continuously adjusts heart function based on positional changes, breathing patterns, and other factors. A well-supported sleep position allows these adjustments to occur smoothly, without requiring excessive compensatory effort from the heart. When sleep is disrupted, whether by poor positioning, environmental factors, or other causes, the heart loses some of this restorative opportunity. Repeated disruptions over time can contribute to cumulative strain, potentially accelerating the normal cardiovascular changes of aging. Conditions that influence sleep positioning. Certain health conditions warrant specific attention to sleep positioning beyond general recommendations. Individuals managing these conditions should consider how their nightly posture might interact with their particular physiology. Congestive heart failure significantly affects sleep positioning needs. Many individuals with heart failure find that sleeping with the head and upper body elevated reduces shortness of breath and allows more comfortable rest. This position uses gravity to reduce venous return to the heart slightly, decreasing the volume the failing heart must pump and reducing fluid accumulation in the lungs. Some individuals require sleeping in a recliner rather than a bed to maintain adequate elevation throughout the night. Atrial fibrillation, a common heart rhythm disturbance in older adults, may be influenced by sleep position. Some individuals notice more frequent arrhythmia episodes when lying on the left side, possibly due to mechanical effects on the atria. Tracking symptoms in relation to sleep position can help identify patterns that inform positioning choices. Peripheral artery disease affects blood flow to the legs, and positioning can influence symptoms. Sleeping with legs slightly elevated may improve circulation and reduce nighttime leg cramps or discomfort. However, excessive elevation can reduce arterial flow, so moderate positioning works best. Chronic obstructive pulmonary disease or other lung conditions affect breathing mechanics during sleep. Positioning that facilitates diaphragmatic movement and maintains open airways becomes essential. Many individuals with COPD benefit from sleeping with the upper body elevated, which uses gravity to assist the work of breathing. Sleep apnea requires specific attention to positioning. Since supine sleep often worsens apnea, side sleeping is typically recommended. For those using continuous positive airway pressure therapy, consistent use remains essential regardless of position. The mask and device settings should accommodate the individual's preferred sleep position. Arthritis and joint conditions may make certain positions uncomfortable or impossible. For these individuals, finding a position that balances joint comfort with cardiovascular support becomes a matter of personal experimentation and, where helpful, consultation with healthcare providers. The cumulative nature of small choices. One of the most important insights from research into aging is that small, consistent choices accumulate over decades into meaningful differences in how we feel and function. No single night's sleep position determines long-term health, but the pattern of choices repeated thousands of times across years shapes the body's trajectory. This perspective can be both encouraging and freeing. It suggests that we need not achieve perfection in any single aspect of rest. An occasional night in an unfavorable position matters little. What matters is the general tendency, the typical pattern, the direction in which our habits lean. Similarly, changes need not happen overnight. Gradual adjustments, patiently maintained, become the new normal over time. The body adapts to new positions, new routines, new environments. What initially feels awkward becomes familiar, then comfortable, then preferred. This gradual approach respects the reality that habits formed over decades cannot be instantly rewritten. It allows for setbacks and imperfect execution. It recognizes that the goal is not perfection but direction. Listening to the body's signals. Throughout this discussion of sleep position and heart health, one principle deserves emphasis. The body communicates. Symptoms that arise during or after sleep provide valuable information about what positions and practices best support individual physiology. Awareness of these signals begins with simple attention. Upon waking, notice how you feel. Is there stiffness in the neck or back? Does the chest feel heavy or light? Is breathing easy or labored? Does the heart feel steady or does it seem to pound or flutter? These observations, collected over time, reveal patterns. Perhaps left side sleeping consistently produces palpitations. Perhaps stomach sleeping reliably leads to morning headache. Perhaps back sleeping with proper support yields the most refreshed feeling. For those managing known health conditions, this self-awareness becomes even more important. Tracking symptoms in relation to sleep position provides information that can be shared with healthcare providers, who may offer additional guidance based on individual circumstances. It bears emphasizing that new or concerning symptoms deserve professional evaluation. Chest pain, significant shortness of breath, or irregular heartbeats that persist or worsen should never be dismissed as merely positional. They warrant medical attention to rule out underlying conditions requiring treatment. The wisdom of simplicity. In an era of complex health advice and ever-changing recommendations, there is something refreshing about the simplicity of attending to sleep position and environment. No expensive equipment required. No complicated protocols to follow. Just thoughtful attention to how we arrange ourselves for the night's rest. This simplicity should not be mistaken for insignificance. The body's responses to position and environment are real and measurable. The cumulative effect of nightly choices is meaningful. Simple does not mean trivial. For older adults who have accumulated decades of life experience, there is wisdom in returning to basics. After all the complexity of modern health advice, after all the conflicting recommendations and miracle claims, some of the most valuable practices are also the simplest. Sleep in a position that supports your heart. Keep your bedroom cool and dark. Establish a calm routine before bed. Listen to what your body tells you. These practices require no special expertise, no expensive purchases, no drastic lifestyle changes. They ask only for attention and consistency. And over time, they contribute to the gradual accumulation of small advantages that shape how well we navigate the later decades of life. The interconnected web of rest and health. Throughout this exploration, certain themes recur. Sleep position affects cardiovascular function. The sleep environment influences sleep quality. Daytime habits shape nighttime rest. Social connection and purpose support overall well-being. These factors do not operate in isolation, but form an interconnected web in which each element influences the others. Consider how these connections might play out in an actual life. A person who sleeps in a heart-supportive position wakes more refreshed, with better energy. They engage in more physical activity during the day. This activity improves their cardiovascular fitness and deepens their sleep drive. Feeling better, they participate more fully in social connections, which reduces stress and supports emotional health. Reduced stress allows easier transition to sleep at night. The cycle reinforces itself, each element supporting the others. Conversely, poor sleep position leading to restless nights can initiate a downward spiral. Fatigue reduces daytime activity. Reduced activity diminishes cardiovascular fitness and may lead to social withdrawal. Social isolation increases stress and rumination. Heightened stress further disrupts sleep. The cycle turns in the opposite direction. Recognizing these interconnections offers multiple points of intervention. Improving sleep position benefits not only nighttime rest, but also daytime function. Enhancing daytime activity improves sleep. Strengthening social connections supports both emotional health and rest. Any positive change, consistently maintained, can influence the entire system. The long view. Aging is not a problem to be solved, but a process to be inhabited. The goal is not to stop or reverse aging, but to navigate it with as much grace, function, and well-being as possible. This perspective shifts the focus from dramatic interventions to sustainable practices maintained over decades. Sleep, occupying 1/3 of our lives, offers a daily opportunity to support this navigation. Each night presents a fresh chance to rest in ways that serve long-term health. Each morning offers feedback on how well we succeeded. The practice is never perfect, but it is always available. For those in the later decades of life, this daily practice carries particular significance. The body has accumulated decades of experience, both positive and challenging. The normal changes of aging have progressed to varying degrees. The foundation of health practices established earlier now expresses itself in how well the body functions. But it is never too late to make adjustments. The body responds to supportive practices at any age. Changes in sleep position, improvements in sleep environment, attention to winding down routines. All of these can begin tonight and yield benefits moving forward. The quiet power of consistency. If there is a single principle that emerges from considering sleep and heart health, it is the power of consistency. Not intensity, not perfection, not dramatic transformation, just the quiet, steady accumulation of supportive choices repeated night after night. This principle applies across all the factors discussed. Sleeping in a heart-supportive position most nights. Maintaining a cool, dark sleep environment consistently. Establishing a winding down routine that signals the body to prepare for rest. Engaging in regular daytime activity. Nurturing social connections. Finding sources of meaning and purpose. None of these practices produce dramatic results in a single night or week. Their power lies in repetition, in the cumulative effect of thousands of small choices aligned in a supportive direction. Over months and years, This consistency shapes the body's trajectory. This understanding can be liberating. It means we need not achieve perfection. An occasional night in an unfavorable position does not undo the benefits of many nights in supportive positions. An evening when the winding down routine gets skipped does not negate weeks of consistent practice. The direction matters more than any single data point. Integrating knowledge into daily life. Knowing about heart-supportive sleep positions and understanding the factors that influence rest are different from actually incorporating this knowledge into daily life. The gap between understanding and action is where many well-intentioned efforts falter. Bridging this gap requires more than information. It requires creating conditions that make supportive choices easier than unsupportive ones. Setting up the bedroom to naturally encourage good positioning. Establishing routines that become automatic. Removing obstacles that interfere with consistent practice. For those who share a bed with a partner, communication becomes important. Discussing the intention to try new sleep positions allows partners to support rather than inadvertently undermine the effort. A partner who understands why you are placing pillows behind your back can help rather than question. For those who live alone, creating accountability through self-monitoring can help maintain consistency. A simple sleep journal tracking position and morning feelings provides feedback that reinforces supportive choices. Patience remains essential throughout. Changes that feel awkward initially become comfortable with repetition. Habits that require conscious effort eventually become automatic. The body adapts to new patterns, given time and consistency. The gift of restful nights. There is something fundamentally satisfying about a good night's sleep. The feeling of waking rested, of moving into the day with energy and clarity, of having spent the night in restoration rather than struggle. This experience is not merely pleasant. It is a sign that the body has done its overnight work effectively. For the heart, a restful night means reduced workload, opportunity for recovery, and preparation for the demands of the coming day. For the mind, it means consolidation of learning and clearing of metabolic byproducts. For the body as a whole, it means repair of tissues and regulation of countless physiological processes. All of this occurs beneath awareness, during the hours when we are not consciously present. The body conducts its overnight work silently, efficiently, without requiring our attention or direction. Our role is simply to create conditions that allow this work to proceed optimally. Sleep position matters because it affects those conditions. The sleep environment matters because it affects those conditions. Daytime habits matter because they affect those conditions. Each factor contributes to whether the body's overnight work proceeds smoothly or encounters obstacles. Looking forward, as the years accumulate, the quality of our rest becomes increasingly central to how well we function during waking hours. Sleep is not a luxury or an optional extra. It is a fundamental biological process upon which health and well-being depend. Attention to sleep position, to the sleep environment, to the routines that surround rest. These are not fussy preoccupations. They are practical expressions of self-care, investments in the body's ability to maintain itself over time. They acknowledge that how we spend the 1/3 of our lives devoted to rest influences the other 2/3 devoted to living. For those in the later decades of life, this investment pays dividends in energy, clarity, cardiovascular function, and overall well-being. It supports the capacity to engage with life fully, to maintain connections with loved ones, to pursue interests and activities that bring meaning and satisfaction. The changes discussed throughout this exploration are within reach of virtually everyone. They require no special equipment, no expensive purchases, no dramatic lifestyle upheaval. They ask only for attention, patience, and the willingness to make small adjustments maintained over time. Tonight, as you prepare for rest, consider what small adjustment might better support your body through the night. a different position, a cooler room, a few minutes of quiet breathing before sleep. These small choices, repeated consistently, accumulate into meaningful differences over time, and the body, in its quiet wisdom, responds to this care with better function, greater resilience, and more restful nights for years to come. The quiet hours of the night, when the world grows still and the body continues its unseen work, represent 1/3 of your entire life. How you inhabit those hours, the position you maintain, the environment you create, the rhythms you establish, all of it accumulates into something meaningful over time. The single most important takeaway from everything we have explored together is this: the body's overnight restoration is not automatic. It responds to the conditions you provide, and those conditions are largely within your reach to shape and improve. If this reflection has stirred something in you, some recognition or curiosity about your own nightly patterns, we would be honored to hear your thoughts in the comments. And if the idea of building a library of health wisdom speaks to you, we invite you to explore other recordings in this collection and to subscribe so that each new edition finds its way to you. This is the Longevity Library. Listen, learn, and live longer.